Today, we're excited to be hosting a panel, The Limits and Responsibilities of Global Health and Humanitarianism with Genocide in Gaza Reveals. Before we get started, let me offer an Atlantic note. And as this is a hybrid event, and some of us are on different territories, we ask you to please give time to acknowledge the land on which you're currently living. So today, we're here on the York University campus, also known as Toronto. And we acknowledge its current treaty holders, the Mississaugas of the head of this nation. We also acknowledge that this is the traditional territory of many Indigenous nations, including the Anishinaabe, the Haudenosaunee Confederacy, the Huron-Wendat, and this territory is also subject to the addition of the film talking about covenant and agreement to peaceably care and share for the Great Lakes region. And this is really just the first step in our process of reconciliation and getting to know our local Indigenous community. So before I begin, I would like to offer some background on each of our panelists to introduce them. And then after that, I will hand it over to our moderator, Dr. Imran Ali. So Dr. Ahmad Abu Shaban is a visiting professor at York University, who's affiliated with both the Faculty of Liberal Arts and Professional Studies and the Faculty of Environment and Teaching. He's the Dean of the Faculty of Agriculture and Veterinary Medicine at Al Azhar University in Gaza. His work focuses on food systems and climate justice, with particular emphasis on how war, blockade, and displacement shape agricultural production and food security in Gaza. Dr. Reem Abu Shomar is a public health and water expert working at the intersection of the humanitarian development nexus. She holds a PhD in water technology with a focus on antimicrobial resistance and water supplies and a master's degree in public health. She's affiliated with the Geneva Water Hub and the UN University Institute for Water, Environment, and Health. That's just up north in Richmond Hill. And Dr. Abu Shomar has worked with national and international agencies and has extensive experience in water and public health with the APP, Global Health Institute's CRWW Fellowship and the Metric Innovation Fellowship. And finally, Dr. Mohammed Al Barayka is a pediatrician with over 10 years clinical practice in pediatrics, neonatology, and general medicine. He served in diverse healthcare environments, including long-term pediatric care at the Ministry of Health, humanitarian work with Doctors Without Borders, and public health research with the UN Relief and Works Agency clinics. Dr. Al Barayka's training includes trauma-informed care, suicide prevention, opioid dependency treatment, and advanced first aid. He is former medical doctor at Awda Hospital in Gaza and MSF's reconstructive surgery project. And Dr. Syed Imran Ali. He's the director of the Humanitarian Water Engineering Lab at the Babel Institute. And as an aid worker and engineering researcher, he's worked in emergency responses and led operational research with MSF and UNHCR across Africa, South America, South and West Asia. Dr. Ali has a PhD in environmental engineering from the University of Guelph and completed a postdoc fellowship at University of California, Berkeley. His humanitarian water engineering lab has been providing technical support to humanitarian response efforts in Gaza since 2024 on safe water programs in displaced person camps and on water quality guidelines for malnutrition stabilization centers. With that, I hand it over to you, Imran.
Thank you. Thank you so much, Mary, for the very warm introduction, and a big thank you to the DI for hosting this event. And a warm welcome to all of our panelists. Thank you so much for joining us and being here. Some of them have traveled from far away to be here, so thank you so much for making time to join us. Before we begin, I just want to offer a few words of framing just to help kind of, frame the event. I guess that's what framing is about. I, like many of you, have been watching the horrors of the genocide in Gaza unfold over the past 2 years. And I have mostly been witnessing it through my phone or through social media, and I'm sure many of you have also. I simply cannot, I could never foreseen the things that we would see through this period, right? And the things that we've seen continue to terrorize our spirits. And I simply cannot think about what it's like to live through and endure this genocide as the people of Palestine in Gaza have been doing for decades now, and most acutely in the past 2 years. All I can try to do is try to understand the perspectives of Palestinians who are surviving, enduring, and trying to stand up against this unmaking of life that's been thrust upon them. And that was really what animated the organizing panel. And I'd like to shout out our organizing panel, Carrie Scott, Dasantila, Golemi Kotra, and Anna Zalik, and Mary Torwitz as well. This is really what animated us to organize this panel together, to understand from Palestinians' perspective what it is that they have seen in the destruction of those core life-supporting systems in Gaza of food, of water, of health. From their perspective, why has this been allowed to go on in clear violation of international law and normative frameworks all over the world? Why has this been allowed to go on? And then in the face of all this, what can we do as researchers, as scholars, as concerned citizens within Europe and in Canada or the global minority world more broadly? What can we do to support Palestinians in their struggle to endure, survive, and to stand against the situation that they have found themselves in? What can we do to support Palestinians in their struggle for inalienable rights of life and self-determination? Now, so for today's event, we have 3 presentations that will dive into food systems first, then water, and then health in Gaza from each of our distinguished panelists. And these presentations will be about 20 minutes each. We'll then have a moderated panel discussion in which I'll pose some questions to the panel, as well as inviting some questions from our in-house audience as well as from our online audience. So please feel free to raise your hand during the question period once we've done the initial questions, if you have questions in-house, or for the online audience, please feel free to add it to the Q&A. I have it in front of me so I can pose these questions to the panelists. We have a limited time together only today, and there's so much to talk about, of course. We won't get to every question and every point, but we will have some informal time after the panel discussion where we can continue the conversation over coffee. So thank you again all so much for being here. And let me first welcome Dr. Ahmed Abu Shaban to talk to us about food systems. Welcome.
Thank you. Thank you very much for organizing and making this platform to actually present the voices of the victims, which is, I found it really a responsibility, ethical responsibility to talk about those victims who were actually not only victims during the genocide, but it is a long-term catastrophe and suffering of the Palestinian people. And maybe one of the maybe I'm going to present about food systems. The colleagues are going to present about water, health, but whatever sector you are going to talk about, we need actually to understand what is the context behind it. The context behind it is a long-term settler colonialism project that is fighting actually to push the people of Palestine, indigenous people of Palestine out of their land, utilizing a wide range of policies, aggression, ethnic cleansing, genocide, but also many other policies to challenge the life of the Palestinian people. And this is very popular map you see here, just showing actually how the demography of Palestine has changed over time. The green color you see here reflecting the indigenous people of Palestine. And when you just think about the change in this, in the green color, and how actually the green color is going to a smaller and smaller pieces of land, this is actually a result of a long-term settler colonialism project. It's not something that happened only in October 23. And this is again another reason why actually I really appreciate the opportunity to talk and the platform to talk about this. Because we need actually to challenge this narrative. The biased media, mainstream media here, presenting the situation as, you know, the whole history of Palestine started only after October 23. Generation after generation, starting even 3 generations ago, till the generation of today, more than 5 generations faced actually the aggression of the Israelis, targeted by different means to achieve what you see. And even what you see here, even the last one here is an old one. This is even before October 23, and the situation is even getting worse and worse. And whatever means you see, like even the Israelis utilizing this evil settler colonialism project is utilizing wide range of policies, even the peace process as a peace process, because peace process, it is a process, but with no result. They keep talking, negotiating the peace process while they keep stealing more and more land. And as you see, here, when you just talk about and this is very important before even starting, what does it mean Palestinian? What does it mean to be a Palestinian? My name is Ahmed. I am Muslim. I am Palestinian. But I know a very popular Christian who is also Palestinian. Do you know who? Jesus. Jesus Christ was also Palestinian. And I also know many Jewish who are Palestinian. Do you know Nader Musaddaqa? Have you heard about Nader Musaddaqa? Of course, the mainstream media would never talk about Nader Musaddaqa. Do you know who is Nader Musaddaqa? He's a Palestinian Jewish from West Bank, from Nablus, who was arrested for a very long time. And he was released from the prison during this, this actually deal with the Israelis. So he's a Jewish Palestinian. What does it mean, a Palestinian? Palestinian is simply the indigenous people of Palestine, being Palestinian Muslim, being Christian, being Jewish, being Arab, being non-Arab. Palestinian is the indigenous people of Palestine. And settlers who are coming from outside to take the land and to tell that narrative, which has no sense, and I just like give the example even for the people here. Just imagine if you just spend your whole life working to establish your house, and someone would just come and knock your door and one day and tell you, listen, my God promised me your house 3,000 years ago, so get out of it. This happened actually to every one of our grandfathers, grandparents, and it happened to all of us. I lost my land, I lost my house, and even the 2 colleagues. My land, the land actually I inherited from my father, who inherited from his father, is actually located now in the eastern Gaza, which is even not presented in these old maps. Palestinians right now live in 2 places, or 3 places actually, where you have also the Arab Israelis who live inside, and they are also discriminated. But Palestinians live in West Bank and Gaza Strip. What does it mean to live in West Bank? West Bank, there is no Hamas, by the way. West Bank, there is no Hamas. You have more than 3 million people live in 227 disconnected districts, geographically disconnected districts, isolated communities, Palestinian communities. And according to this peace agreement with the Israelis, the Palestinian territories in West Bank is divided into 3 areas, area A, B, and C. A, which is standing for 18%, where actually should be fully controlled by the Palestinian Authority. While it's not, like every day now they are invading the land, destroying, killing, arresting every day. And Area B, which according also to that agreement, it should be jointly controlled, which stands for 21% of the West Bank, while it's currently fully controlled by the Israeli occupation, and 61% of West Bank, which is controlled temporarily for 30 years by the Israeli Authority till we just like reach the final agreement to establish our Palestinian state. Actually, they kept stealing the land there, building the illegal settlements. And when I say illegal settlement, this is not the Palestinian vision talking about illegal settlements. This is the international law talking about illegal settlements. Every day they are taking more and more land to build more and more illegal settlements, where actually they accommodate around 500,000 of the Israelis. So someone who's coming from New York or Toronto or I don't know from Poland, so he has the right actually to take that land simply because he's Jewish. And again, this is the narrative they are trying to use. And what I believe, Judaism as a religion has nothing to do with all this story. Because this is actually, it's exactly like the ISIS, utilizing actually the Islam to tell narrative. You know, it's always when someone just telling you the religion is just giving you kind of a justification for terror, for even like taking the rights of others, that can never be actually a reality. I mean, when you say disconnected districts, do you know what does it mean disconnected? This is what does it mean? I mean, it's disconnected, geographically disconnected. If you would like to move from one place to the other, you have to go through those checkpoints. Every day, if you are going to your school, to your work, even if you just would like to go to the hospital, many people actually lost their life in those checkpoints, the Israeli checkpoints, dehumanization of the Palestinian. And any one of you is coming from agricultural background or farming background, do you know actually why, for which purpose those corridors are used? Usually, for which purpose those are designed? For dairy cattle. And they are utilized in checkpoints in West Bank. Gaza. So the situation in Gaza is really horrible, because the situation in Gaza, it is the largest open air prison where you have around 2.2 million people live. And not talking about the history, because you know, I usually, when I talk to donors and NGOs in Palestine, I just say Gaza is the sustained crisis for more than 60 years. They keep it as a crisis for 60 years. But thinking only about the last 20 years, there was a strict blockade on Gaza. And this blockade actually has affected all means of life for the Palestinians, challenged all means of life for the Palestinians. Their food system, education, health, infrastructure, environment, society, economy, everything has been affected, increasing food security, food insecurity, increasing poverty, unemployment, affecting even infrastructure and public services. And thinking about food. Food actually is related to land, and land is the question. I just want to present things of actually how our food system was controlled and challenged by the Israelis before October 23. Here what we called access restricted area. Access restricted area, which is called by the Israelis as the buffer zone. What does it mean, buffer zone? Buffer zone, this is the area that Palestinian, we own the land there, but we are not allowed to utilize the land. So land use is restricted by the Israeli forces. And this is eating up around 1/3 of our Arab land. 17% of Gaza Strip land is taken in this access restricted area. And 1/3 of our arable land is located in this area. So we are not allowed actually to cultivate anything inside this land. Or because it's like it has different degrees. In some degrees, you are allowed to cultivate, but not more than one meter height. So it has kind of a restriction on how we use our land. And this is affecting, of course, they have even the authority always to come inside and destroy whatever you do there. And this is long before, this is 20 years before October 20. But it's not only the land, but also the sea. We are not allowed to use our fishing area. 85% of our fishing area is restricted by the Israelis. And our fishermen, if they just cross the borderline put by the Israeli, they just killed it. And of course, like many of our fishing fishermen were killed. And of course, this both things has affected our capacity to produce food locally. But this is not the whole story. I mean, when the recent United Nations report on famine in Gaza was released, Israelis, as usual, they denied. They said, no, we never do this. And this is, this is a politically biased and something like that. It's United Nations, it's not the Palestinians saying that. But this reflection of something from the history, and maybe you know about this. You know about this red line policy? Red line policy that was actually in 2007, after the Israelis just put the strict blockade on Gaza, they decided we are not allowing food in Gaza. We are going to calculate the minimum caloric requirements per person in Gaza, and we will transform this into amount of food. And only this amount of food is allowed to come inside Gaza. And at that time, when they just issued this policy, or when they were just implementing this policy, there was Gisha, which is a human rights organization in Israel. They were talking about this policy. And then, as usual, the Israeli government said, no, this is criminal, we never do this. And then the Gisha, or the organization, went to the Supreme Court, and they won, actually, the case. And then the policy was released in 2012. So it was fact. I mean, they were implementing this, utilizing food as a weapon, long before October 23. But it is not only this. It is what they are allowed to come inside Gaza to produce our own food. Agricultural inputs. The Israelis, they have a funny long list. It's called dual use list, which just imagine anything coming inside Gaza should go through IDF-affiliated organizations called GUGAT. GUGAT is just checking for security reason every and each item coming inside Gaza. So many of our inputs are not allowed inside Gaza simply because they were not allowed by GUGAT. And they say, okay, this can be used for agriculture, but also it can be used for military purposes. So it's not allowed to come. So they were actually controlling even the inputs that is coming to Gaza. And I mean, the whole situation has affected availability of resources in general, even the capacity of local authorities to help to solve the problem. But was this actually the ongoing genocide, the first war in Gaza? No, it was not the first one. There was one in 2008, 2012, 2014, 2021, and 2020. What I'm showing here, I'm showing even like some cases where actually it's not a massive war. During those massive wars, the food system was targeted. The infrastructure of farming system was targeted several times. But even between war and war, so the Israelis always have the authority to come inside Gaza land, Gaza territories, and destroy farming assets. Like I'm just giving here a period between 2018 and 2020. Why 2018 and 2020? There was no war in this period. And this is actually the level of destruction that happened at that time. Greenhouses, water wells, animal shelters. So this is usual targeting of our agricultural or farming communities, affecting, of course, not only farmers at micro scale, but also at macro scale they are affected. Herbicide spraying. The Israelis are just utilizing herbicide spraying as a regular act, and they are using this only for the purpose of security. We need a clear vision, so they come inside our land and they just spray herbicide, kill all the crops of the Palestinian people. Opening of winter dams, destroying Palestinian farms, and this is practiced, by the way, not only in Gaza Strip; it's also practiced in West Bank. In West Bank, the illegal settlers in the West Bank, they actually discharge their wastewater into the Palestinian communities, untreated wastewater in the Palestinian communities. So, I mean, all this has created a situation which is really a fragile situation. I mean, thinking about what kind of efforts or interventions can be made by the national or even by anyone who's coming to help, to support. Thinking about development, no, actually, all what we are trying to do is always just emergency humanitarian to help the Palestinian people actually to overcome the crisis. Instead of thinking actually of establishment of kind of a resilience, developing system, we are trying just to take care of the crisis. This has led to a dramatic situation even before October 23. The numbers I'm showing here, actually, those are before October 23. We have 50% of the Gazans before 2023, they were actually food insecure. And most of our food was actually dependent on what is coming from Israel and controlled by the Israelis. But still, I mean, Palestinian always presenting very good example of resilience. And, you know, usually I really like just to use the story of my father. My father has a land in ARA, cultivated with olive trees. Olive trees would need like 3 to 5 years to be productive. And every time he cultivate, and when the trees are like 3 or 4 years, the Israelis coming with bulldozers and cut the trees. My father would go and invest again to cultivate the trees. 1 time, 2 times, 3 times, 4 times, 5 times. And then, you know, I am agricultural economist. You know, I'm this kind of person who just like cost benefit analysis. And I'm just telling my father, okay, listen, we are just putting the cost. Where is the benefit out of that? Where is the revenue out of that? I mean, it's not logic. I mean, we're spending a lot of money with this thing, yeah. And he taught me a very good lesson. He told me, okay, let them cut it 100 times, and we will recultivate it 101 times. We are still there, and this is our land, and we will never give up. The last thing my father was mentioning before he passed away in the hospital, he was talking about the olive trees in our land, asking us to take care of the olive trees there. And this is the adaptation and resilience model of the Palestinian people. What happened during the October 23? It is actually simply a shift from challenging, controlling the system to annihilation of the system. So they shifted actually, you know, and therefore, you know, many times I just like, I really like to challenge this, or even just try to be critical for the mainstream media when they just like reflect what's going on right now there. I mean, in the first day, on the 7th of October, the officials, the Israeli officials, the Israeli minister said, no food, no energy, no electricity, nothing is going inside Gaza. The question here, how come, in which authority, in which capacity the Israelis can control this? This is a long-term policy. It's not something that happened only on the 7th of October. That happened long-term before. I mean, it is a history of actually trying to have this strict control. And this is what's going on right now in West Bank, with all the gates that are actually installed in West Bank to isolate Palestinian communities. This is the control they are trying to control. And now it is the time, actually, since we have the full control, we can now just impose and utilize the food as a weapon to start. And here I'm just showing the study done by FAO, just reflecting the level of destruction. And what we see in the destruction, it is a systematic destruction following the value chain of local food production, starting from water resources to agricultural infrastructure. And all the red color you see here is the destruction of farm assets in different farm activities, thinking about vegetables, orchard, or field crops. This is very interesting. This is a project was covered actually kind of one, maybe the biggest project in Gaza in the climate adaptation. That was actually funded by Green Climate Fund to establish irrigation scheme using treated wastewater and also energy plant to operate this scheme. And that was actually one of the first infrastructure that was destroyed by the Israelis at the beginning of the genocide. Livestock either were targeted directly or starvation not only for a human being, but also for animals. No fodder is allowed. No fodder is allowed. The animal starved to death. So, and this is what happened actually in Gaza. And it's really very painful to say that maybe the only animals could survive in Gaza, stray dogs. Do you know why? Because they were fed on dead bodies. That the Israelis did not allow us actually to collect the dead bodies and bury them. Here are some photos showing actually the systematic destruction. It's just like fertilizer stores, pesticide stores, fodder factories, hatcheries, greenhouses, open field, agricultural cooperatives, solar system, irrigation system. It is a systematic. Even food processing units, bakeries were destroyed in a systematic way. And targeted. I mean, my colleague had actually solar panel system in his house. Left his house, he went to the south, displaced in the south. The neighbors were utilizing this solar panel to operate water pump, to get pump from nearby well. The Israelis called him in the south and told him, listen, if you do not ask them to stop pumping water in northern Gaza and leave that area, we are going to destroy the solar panels. And they did. Here are actually what happened. And all of you actually are aware of the famine that was announced by United Nations. And when we talk about IBC, this is IBC, it's internationally acknowledged assessment of the famine. And even, you know, I was part actually of that, of the committees in a certain period of time to develop this IBC analysis. And usually I had the problem even with the language utilized in this IBC analysis, because, you know, there is a starvation, you know, like as if, you know, it's always passive language, as all we do not know actually who did the starvation or how this happened. Talking about Numbers always just dehumanize, reflecting the stories of Zaina, 10 years old child who was hungry, and she just tried to get some bread. She was suffocated and she died. Azim Abu Dagga, one of my brilliant students, and he was leading the World Kitchen mission in Khan Yunis to feed the people. And he was targeted in his car with 2 of his colleagues and were killed. The car was actually labeled and known as international mission trying to feed the people. And of course you hear about those massacres, the flower massacres, that the people just in northern Gaza, they were not, allowed to get any food. They were starving, and then under the Israelis were utilizing actually flower the flower cars, or the flower coming inside Gaza, utilizing them as a trap. It's coming inside, people are gathering around it, and then they attack it. Hundreds of people were killed. And even what the Americans did in this humanitarian, the unhumanitarian. Again, we are Palestinians. We are simple, always a symbol of resilience. Yusuf Abu Rabia, one of my students in his last year in bachelor degree in agricultural sciences, he was in Beit Lahia in northern Gaza. Beit Lahia was received evacuation order by the Israeli authorities. People rejected, they don't want to leave. They resisted on their land. The Israelis decided not to allow any food to come inside Gaza, inside northern Gaza, especially in Beit Lahia. And then what Yusuf did, he said, no, I'm going to, and his farm, as you see here, his farm and his house was destroyed. He went to the destroyed seeds stores, picked some seeds from the destroyed stores, started with a small nursery to produce seedlings, and distributed the seedlings to the neighbors, starting with an initiative called Hanizraha, we will cultivate it. And he was producing vegetables to feed the starving people in Gaza. I'm quoting his words in Arabic. سنزرعها حبا وحبا وسنرويها دما ودمعا. We will cultivate it with seed and love, and we will irrigate it with tears and blood. And he did. They killed him while he was farming his land in October 24. October 24, he was killed. But from Yusuf, we learn actually resilience. Different model of resilience, community kitchens, seed bank. We're trying, actually struggling during the genocide to help the starving, the starved communities inside Gaza. And of course, different even mechanisms. We're trying actually to establish this community of resilience, women working together to find ways actually to communicate, to provide extension services, guidance, how actually to survive and to cope the crisis. With their resilience and your support, reflecting their voices, because these voices is not only the suffering after October 23, it's a long-term suffering. And I think it is our all of us, our ethical responsibility to keep talking about them and keep talking about suffering, their suffering, till actually we just see the justice in Palestine. Free Palestine. Thank you very much.
Thank you so much, Professor Abu Shaban. Thank you for sharing the stories of your students. and their acts of resilience and resistance in the face of devastation of the genocide. Thank you so much for sharing that with us. I'm sure there's a lot of questions in the crowd, but what we'll do is we'll move to the next presentation and then we'll have a question period at the end. So I'd like to invite Dr. Reem Abu Shamar next to talk about the water system in Gaza. Yes.
Good afternoon, everyone. Well, before starting, I would like to thank Professor Mary for the introduction and Dr. Imran for facilitating this session. And thanks to the Hadal Institute for Global Health for organizing and hosting this session. And thanks to Dr. Ahmad for framing the ground around the food and the humanitarian support. And actually, I'll be building on that, speaking from water, sanitation, and hygiene perspective to show what the genocide in Gaza reveals about humanitarian and global health.
There we go.
Thank you. So I'll start by giving a contextual background on washing humanitarian settings, and then we'll speak about weaponizing of water, giving real example from Gaza situation. And after that, I will present some WASH-related public health rollouts. And after that, maybe I'll have a kind of short discussion around the neutrality and moral responsibility of humanitarian aid. And lastly, I'll conclude with key takeaways. So the role of WASH in humanitarian emergencies is usually underrepresented and unseen in fragile settings or other war-related or war zones. Considering that it's a core function for public health, WASH and water sanitation and hygiene are foundational to public health, foundational to dignity and survival. They are needed to prevent waterborne diseases, and they are integral to maternal and child health. They are also needed for trauma and wound care, particularly within the genocide context. The amount of water needed during emergency is defined within international standards such as SPHERE and BOC, and the WHO published a lot of useful guidelines regarding how to maintain safe water and sanitation within conflict settings. And that's why WASH is considered as a critical determinant of public health. And globally, more than 1.4 million deaths are attributed to unsafe water and sanitation. And diarrheal diseases is considered the second leading cause of deaths among children below 5 worldwide. And WASH was also important to maintain infection prevention control within hospitals, particularly to prevent nosocomial infections related to antimicrobial resistant organisms. So water is a basic human right, and thanks to the former UN Secretary General Kofi Annan, who stated that access to safe water is a basic human right, and this human right entitles everyone to sufficient, safe, acceptable, physical, accessible, and affordable for both personal and domestic use. And targeting any of the civilians or vital objects related to civilians' survival considered or strictly prohibited under the international humanitarian law. Prior this genocidal war, Gaza was a home for more than 2 million people who resides within just 365 square kilometers. And during the war, survivors were forced to concentrate within only 14% of this small area. And you can imagine that. The density reached around 30,000 person per square kilometer. And one more thing that about the status of water resources prior to the 7th of October, that the only natural water resources for Gaza was the coastal aquifer, which according to Palestinian Water Authority and UN reports, 96% of it was unfit for human use, either because of salinity or contamination with nitrate. And as a response to this water insecurity, the Palestinian authorities tried or adopted strategies for additional water resources based on non-conventional resources for water, including seawater desalination. And you can see the photo on the left for one of the projects established in the middle area to help provide safe water to Palestinians. And the second one is related to the wastewater treatment plant that serve to help with providing water for agricultural use from the reclaimed water. And both of them have been affected by this genocidal war. Shifting to the militarization of water. On the 9th of October, 2023, Israeli officials, military officials, started publicly to announce that Palestinians are not human, and there will be no water, there will be no food, and there will be no electricity or fuel. And this is the photo of Gallant when he started to state this statement publicly before the eyes of everyone. And you can see in this map the level of mass destruction that reached almost around 90% of the land in Gaza, covering 90% of the water resources, which has been either damaged or destroyed. And based on Oxfam report, the access to safe water dropped from 90 liters per capita per day, which is already low prior to this genocidal war, to reach less than 5 liters per capita per day. You can imagine that. And this photo on the right related to the destroyed desalination plants in the north area. In June 2025, UNICEF Executive Director, Ms. Catherine, mourns the killing of 7 children while fetching water. Is this the only story? No, it's one of the documented stories. And you can see the jerrycans here stained with the blood of civilians who were trying to get one of their very, very basic rights, fetching water. Humanitarian workers, including those who were providing water, who were in duty, were also targeted by the Israeli forces. And many were killed or injured. Israelis also cut off fuel and electricity needed to operate desalination plants and wastewater treatment plants, preventing access to safe water and sanitation. So what are the public health fallout from deprived water sanitation and sanitation services. Diarrheal diseases surge based on UNRWA and Ministry of Health reports, and polio re-emerged after 25 years of being eliminated, and both triggered by the collapsed water and sanitation. The outbreaks of hepatitis A, skin diseases, lice infections were also reported within the overcrowded shelters. And this, for sure, will contribute to the indirect mortalities and morbidities. Hospitals were struggling to maintain infection control and prevention and struggling with sterilizing equipment. And this will, for sure, will increase the spread of nosocomial infections, particularly that caused by the multiple drug resistance bacteria. For women, girls, and mothers, menstrual and maternal hygiene has become something impossible. And there is a lot of testimonies and quotes within the UN Women report issued during this genocidal war. And without toilets, without washing facilities, without privacy, all family members were deprived from the most basic human rights. Even after the ceasefire, one of the recent household assessments highlighted that around or more than half of the population households still suffering from water insecurity, and they have less than 6 liters per capita per day for drinking, and around 28% also doesn't have the water needed for domestic and hygiene purposes. Around 60% of the households were suffering from waterborne diseases, from hygiene-related infections, including skin infections and other related rashes. And here you can see one of the very useful publications that addresses the issue of urbanizing water in Gaza. The first one authored by Professor Mike Zaytoun within Geneva Water Hub and Natasha Carney. And the other one was a policy paper authored by myself. It's about, the name was because it was published during the genocidal war, Beyond Survival, the Wash Crisis in Gaza and the Need for Ceasefire and International Action. So when speaking about humanitarian aid, traditional humanitarian aid emphasizes neutrality and impartiality. But in Gaza, neutrality in the face of the documented war crimes could be or become an ethical dilemma. Any health providers need to either to prevent this kind of weaponizing water, or at least expose any acts that can show this kind of weaponizing. And one more thing about the artificial use and use within the humanitarian settings, and it's actually very useful when it comes to need assessments and logistics and population tracking. But in Gaza, AI was deployed to targeting civilians, including those children who were trying to fetch water. So this highlights a flag that we need an urgent ethical AI framework in conflict zones and war zones. How geopolitics can affect humanitarian aid. Well, looking closer to the humanitarian aid within different war zones, we can notice that geopolitical interests usually shape the speed and the scale of intervention. And this appeared when we tried to compare the humanitarian response within Gaza compared to the Ukraine. You will find the disproportionate aid and funding priority. And also, we need to consider that how the Israeli narrative initially dominated helped to delay any humanitarian response. When the Israelis framed genocide as security threat and the humanitarian aid as a terror enabling, rather than addressing humanitarian emergency. And this is actually in the face of context of genocide, times mean lives. We also need to acknowledge that the very useful help provided by the humanitarian NGOs to help Palestinians restoring their their dignity at least, and to help them to survive and to be more resilient. But also humanitarian international and local NGOs were facing by themselves a lot of challenges related to their staff security and access restriction. And even within their headquarters, there was a lot of restrictive funding mechanism when it would come to Gaza. In addition to that, the introduction of militarized aid model. I'm speaking here about the Gaza Humanitarian Foundation that was introduced in 2025, raises alarms over transparency, equity, and moral of humanitarian aid. It's what to say that Gaza infrastructure, including the wash infrastructure, shaped by decades of occupation and control, which limited the Palestinian autonomy and caused something to hinder the development process by design was systemized through creating dependency rather than sovereignty. And Amnesty International defined this as hydro-apartheid to show the discriminatory access of water between the Israelis and Palestinians. So it started from blockade to dependency and wash collapse. And this is a structural colonialism and deliberate dismantling of civil survival system. Is it about Gaza, as Professor Mohammed said? No, it's not only about Gaza. Israelis control more than 85 Palestinian water resources within Gaza, with the West Bank, Area C. And they keep useful or severely hindering the access to land and water. In the West Bank, illegal settlers enjoy unrestricted access to water. Palestinians have less liter per capita per day, and usually Palestinian farmers are forced to pay 5 to 10 times more than the settlers for the same amount of water. And you can see here one of the published news about the Israeli who destroyed greenhouses and water wells in Bethlehem. It's in the West Bank. Why is it important to invest in water within the humanitarian response? Because It's needed, it's critical, it's essential to mitigate further public health emergencies. And it's important to restore the dignity of displaced people. And without safe water and sanitation, there would be high risk for waterborne diseases. And it's became a reality in Gaza. And the long-term benefit of the WASH investments would help to reduce the indirect related mortalities and morbidities. So to conclude, this genocide has not only taken life, but also caused severe damages to civilian infrastructure, especially water and sanitation. And water security in the face of genocide requires human security and political stability. And international support for sustainable ceasefire and humanitarian access in compliance with the international law and rooted in equity is essential to build justice and resilience. And that weaponizing water and imposing restrictions on humanitarian aid have created conditions that hinder life-saving efforts and violate international humanitarian law. Immediate investments are needed to restore WASH services and prevent a full-scale health disaster within humanitarian development nexus and with the help of Palestinian experts within Gaza. And there must be an accountability for the destruction of donor-funded water infrastructure through independent international investigation. And here I wanted to present some recent appeals by the humanitarian sector in Gaza. They appealed for around $400 million to restore access to safe water and sanitation, in addition to have vector control and to maintain menstrual hygiene and dignity. And thank you for your active listening. Join us whether in person or virtual. Thank you.
Thank you so much, Dr. Abu Shamar, and thank you so much for sharing your experience being part of the WASH response in Gaza over the past several 2 years. So thank you so much for sharing from your experience in Gaza. Next, I'd like to welcome Dr. Mohammed Al Barayka, who will speak to us about the health system. Dr. Al Barayka, welcome.
Thank you, Dr. Amran. Thank you, Professor. Thank you, everybody, for this opportunity to talk about the situation or health situation in Gaza. Really appreciate it. And first of all, I will talk about the number and locations of hospitals in Gaza, impact of attacking hospitals on the people of Gaza, challenges faced by healthcare workers, how medical students and doctors continue their studies and treat people. Did the war affect current and future generations, and how can we help them? First of all, we can divide Gaza into 5 governorates. The first one in the north of Gaza, including Beit Lahiya and Beit Hanun, Jabalia. The second governorate is, we can say, it's Gaza City. The third one in the middle area, Deir al-Balah, which contain Maghazi, Brej, and the fourth one is Khan Yunis. The fifth one is Rafah. By the way, Rafah, the fifth one, totally destroyed the city, and all the people there had been displaced to Khan Yunis and the north area. So unfortunately, Rafah now is a city from the history. The distance between the north area in Beit Hanun to the south is like 41 kilometers. So you can drive it like in 25 to 30 minutes from north to the south. Gaza health system has 36 pre-conflict hospitals, but as of late, 2025, only a fraction are partially function due to the widespread damage and lack of resources. Reports indicate that between 17 and 19 of the 36 hospitals remain operational to some degree, while the majority are destroyed, damaged, or out of service. This photo from the Kamal Udwan Hospital, which is located in the north of Gaza. Actually, this is after airstrike bombing with F-16 to the pediatric department. Some of the patients there have been killed, and we are talking about children, and also some others are injured. Actually, this genocide or this war, till now, and I noticed it's children and mothers. Operational status. The majority of hospitals are non-operational, destroyed or severely damaged. About the field hospitals, there are also 11 field hospitals operating, but they are a supplement and can't replace the destroyed health system. The challenges: the operational hospitals are struggling with severe supply shortages, lack of health workers, insecurity, and a surge in casualties. The second title will be about the impact of attacking hospitals on the people of Gaza. This picture is for one of the paramedic in north of Gaza, lost most of his family members, looking around himself in the hospital. What can he do? What can he take to continue his life? Let's listen to this video.
انت من وين؟
من غزة.
من وين من غزة؟ من الشاطئ ولا من وين؟
من الزيتون.
من الزيتون. هذه والدتك؟ حبيبتي الله يرحمها، الله يرحمها يا رب. هم بدفنوها؟ الله يرحمها.
Maybe the voice is low a little bit, but you saw the subtitles. It's for this little girl, like maybe 8 years old, looking to her mother while they are burying her in a random grave. Recently, during the genocide, Israel bombed and attacked most of the graves, most of the lands, to put the people inside, the dead bodies inside it. So this girl, I can't imagine how she can tolerate how they are putting or burying her mom in a random grave, because there is no fixed graves there in Gaza after this war. Collapse of the healthcare infrastructure. With so many hospitals out of service, as you know, capacity to treat the wounded or sick is drastically reduced. Shortages of critical supplies, attacks, and restrictions make it extremely difficult to get medical supplies, medicines, blood product, and even for generators. Increased mortality and suffering, forced evacuations or shutdowns of hospitals mean that patients may need to be transferred under perilous conditions or may not receive needed treatment at all. Disruption of specialized care. Some hospitals that offer the specialized services as neurosurgery, cardiac care, cancer treatment are no longer operating or only partially functioning. Especially for the patients with cancer, these patients need regular chemotherapy sessions and other treatment, lost their lives because of lack or because of the closing of the borders. Chronic diseases management suffers. People with long-term conditions such as diabetes, mellitus, heart diseases, thyroid disease may not get regular treatment, increase the risk of complications, and not an easy complication. Patient with heart disease, hypertension, he didn't take his treatment, will develop to the stroke or other severe complication. Mental and psychological toll. The constant threat and actual attacks make hospitals places of healing into unsafe zone, which heightens fear and trauma for patients, families, and healthcare workers. Overworked and traumatized medical staff face extreme stress, burnout, and risk of injury or death themselves. And that's what happened for most of the colleagues there in hospitals. He's working in the ER, he's working in the theater room, and received a call, please come to the ER right now. And when he come or when she come to the ER, she found or he found most of his family member had been killed during the attacks. We can't forget Dr. Ala al-Najjar, who lost 9 of her sons and daughters during the attack to South area. And after couple of days, she lost her husband. Dr. Ala al-Najjar was working in Nasser Hospital in pediatric department, treating people there, treating child, and she received a call that come to the ER, and she found all her family members had been killed. Now, the challenges faced by healthcare workers. This picture had been captured in Ashifa ER. Ashifa Hospital ER showed how the doctor and surgeons there practicing their work under severe stress and under a big number of patients there. They are making external fixation insertion, what they're meaning that the fractured bone need to be fixed with external fixation device outside. So they are making it under the minimal dose of the anesthesia, which means a lot of the patients had a major surgery with this mess, with this taking care of any infection control, and the doctors should treat him or should treat them, or unfortunately to say who should stay alive or we can't make CPR with him. The challenges faced by healthcare workers: high casualties, deaths, and injuries among health workers. According to the United Nations and OCHA, as of October 2025, over 1,700 health workers had been killed, which means two healthcare workers killed every day on average during Israeli genocide in Gaza. And it's not a small number at all. Severe shortage of medical supplies, drugs, and equipment. Diagnostic and life support equipment is limited or destroyed. For example, critical care units are missing vital machines after attacks, and we can't at all imagine that use ICUs without mechanical ventilations due to the attacks. Infection prevention, IBC, and hygiene conditions are degraded, which increase the risk for both patients and staff. Overwhelming workload and burnout. You are talking about 2 years and more. Health workers are under extreme pressure, massive numbers of trauma cases, displacements, and daily casualty surges. Separation from family, evacuation orders exacerbate the stress. Displacement, loss of staff. Many medical personnel have been displaced, unable to reach their workplaces. The war has caused skills imbalances because some experienced staff are lost or forced to leave, reducing overall capacity. Psychological trauma. Healthcare workers face trauma from seeing high volume of severely injured and dying patients, often without resources to treat them properly. This photo for Dr. Hani Psiso, orthopedic surgeon. He's making below knee amputation for his niece. She's 17 years old, to save her life in his house over the dinner table without anesthesia and under the siege. He sutured the stump after amputation with sewing needle. And after a couple of days, he could refer her to the nearest hospital, Shifa Hospital. Dr. Ahmed Al-Maqadma, one of our friends, mentioned on WhatsApp group, I closed the stump for her later. He's talking about the patient. She got better. Dr. Hani was very sad to amputate her leg at home while they was surrounded by tanks. Hopefully, she fit prosthesis, and hopefully this genocide stopped. This was in January 2024. In April 2024, Dr. Ahmed Al-Maqadma, who closed the stump in the ER, was found with his mother, Dr. Yusra Al-Maqadma, a Norwa teacher, killed. They were among the hundreds of bodies executed by Israeli soldiers during the invasion of Shifa Hospital. I worked with this doctor. He was full of life, planning to be a good and big orthoplastic surgeon. Working with personal trauma. Surgeons and residents have been forced to endure the loss of surgical colleagues killed and abducted by Israeli forces while at their workplaces and homes. All surgeons and residents in Gaza have lost members of their extended families. Many have immediate family members, including their own children, who have been killed. This picture for two of doctors, our colleagues with a blue t-shirt, Dr. Adnan Al Barayka, orthopedic surgeon and head of department in Al-Shifa Hospital, died following reported torture in Israeli detention in April 2024. And Dr. Mohammed Obaid, other doctor, orthopedic surgeon, abducted by Israeli forces and illegally detained since October 26, 2024. Physicians for Human Rights Israel has launched a comprehensive report reveals a systematic killing of Palestinian detainees and prisoners held in Israeli custody, followed by cover-ups and concealment by Israeli authorities concerning the deaths. Of the 98 total deaths documented, 46 deaths occurred under the Israeli prison service, and 52 Palestinians, all from Gaza, died under the Israeli military custody. Main causes of death resulted from a consistent pattern of systematic violence by guards and severe medical neglect. How medical students and doctors continue their studying and treat people in Gaza. In general, we have two medical school campuses in Gaza, Islamic University of Gaza and Al-Azhar University. The training programs at three sites mainly, at Shifa Hospital, Nasser Hospital, and European Gaza Hospital. These two photos for the Islamic University before the war and after the war. How the targeting for the universities was in this war. Everything had been destroyed. Not only the universities targeted, also the schools, mosques, churches, every single thing said that we are here in Gaza. Continuing the surgery life cycle. Residents in orthopedic surgery continue to study for and write advancement exams, including the end of training board examination. Programs admitted new first-year residents in 2024 and 2025. This photo for Dr. Ittihad Shper. He's a retired orthopedic surgeon, leads an introduction to orthopedic history taking for a new first-year residents morning teaching session in European Gaza Hospital. Another image for students in library in European Gaza Hospital, medical students study in the hospital library where there is a space, electricity, and Wi-Fi before the invasion of the European Gaza Hospital in 2025. So all these things had been destroyed and become rubble. Another photo from the Nasser Hospital for the orthopedic residents routed into an on-call room to take a scheduled examination. So they are taking their scheduled examination in these rooms. Limitations in clinical exposure. Elective orthopedic surgery has been essentially impossible to schedule since October 2023 because of the situation. Residents thus primarily gain clinical experience assessing and treating open and to a lesser extent closed fractures as well as the bone infection, which complicates many cases. Because of the war, a lot of patients had a complication with osteomyelitis or bone infection due to the absence of the IBC, absence of the antibiotics, and because of the severely infected wounds due to the rockets. Here, the department head instructs senior and junior residents in a complicated surgery called sural nerve harvest for nerve grafting in a 9-year-old female patient injured in airstrike. And also the 50-year students following and watching. This is another case had been done under the difficult situation, a rare case of scoliosis surgery done by a senior surgeon at Nasser Hospital. One of the challenges was there in Gaza that a lot of the external fixation devices had been prevented to be entered or to go inside Gaza due to the siege and the border closure. So what happened here? One of our colleagues is Dr. Mohammed Obeid, who is now in the prison, and other doctors trying to create a new device such as external fixation in the maintenance area in the hospital, so they can help the people to put this external fixation to the fracture bone and to help people. And it's passed. Fortunately, it's passed. Did the war affect the current and the future generations? It's another question of our titles. Breakdown of maternal and newborn healthcare. Many maternity wards and the neonatal intensive care units have been damaged or non-functional. UNICEF says that at least 3 in ICUs in the northern Gaza have been destroyed, and the number of incubators has dropped dramatically. Increased risk of premature and low birth weights because of extreme stress, malnutrition, and lack of perinatal care. A large share of babies are being born prematurely or underweight, which increase the risk for mortality and long-term health problems. Higher newborn mortality. UNFPA reports that at least 20 newborns died within 24 hours of birth in the first 6 months of 2025. Acute and chronic malnutrition in children. Rates of acute malnutrition among young children rising rapidly. WHO says wasting severe thanis in children under 2 has surged after 2 years. Long-term physical growth impact. Severe and prolonged malnutrition in early childhood can lead to stunning. Children may not grow to their full physical potential. Developmental effects on children. Chronic stress during childhood is linked to impaired cognitive development, difficulty concentrating, and long-term health problem. And the last one, education setbacks. Our kids there more than 2 years without school, without regular moving to the schools. That means missed years of schooling, reduce the future income, employment, and mobility. How can we help them? By the medical aids, by medical delegations, which help more and more our doctors there. Medical camps also. If we can offer for them universities scholarships, online free medical psychological courses, and also usually talk about them everywhere, every time, in social media, here in universities, to not forget our people there. Hospitals are not war zone, not a target, but unfortunately in Gaza, hospitals become a war zone and a target. Last photo for my colleague, Dr. Mahmoud Abu Njela. I worked with this doctor like 5 years in an Awda Hospital with Doctors Without Borders. He wrote before he died, whoever stays until the end will tell the story. We did what we could. Remember us. Dr. Abu Njela had been killed with another doctor, Dr. Ahmed Al-Sahar. He was my replacement before I came here to Canada. Dr. Ahmed Al-Sahar also killed in Awda Hospital. Dr. Abu Njela left like 3 kids with his wife away from any supervision and to say dad or baba for him. Please don't forget Gaza. Thank you.
Shukran. Thank you so much. I know how difficult that is for you all to talk about, so thank you so much for sharing everything you did today. We want to open it up to a conversation now, and I see already there's some questions coming in on the online chat, and I invite the in-house audience to formulate some questions. As you take a moment to think about your questions, I would like to actually pose a question to the panel. in the face of so much suffering, there's a natural impulse in people to want to do something to help, right? Humanitarian response efforts that aim to provide that life-saving aid, so critical medical care you describe, or safe water or food, these are often the expression of that natural impulse to want to do something to help. However, humanitarian aid can also be a double-edged sword. In the worst cases, it can create dependencies that undermine local capacities or even enable the persistence of the situation that created the humanitarian crisis in the first place. In your perspective, from your experience, what is the appropriate role for urgent international humanitarian aid, and what are its limits or risks that it poses? What is its dual function, so to speak? And then what are the responsibilities of people who are concerned with global health and humanitarianism internationally to go beyond just the bandage of aid to something more lasting? So I open it up to the panel, Professor Shibboleth.
Yeah, I think this is very important question, because what is needed? And when we are going to think about development in Palestine rather than humanitarian aid, I mean, maybe you observed in the three presentation, actually, to wide extent, all our systems, food system, wash system, health system, education system, is dependent to wide extent on humanitarian aid that is coming because of the occupation, because of geopolitical context. Now, being involved myself in humanitarian work in Palestine with United Nations, with donors, we have always this restriction by the geopolitical context. I mean, now just imagine, I mean, right now, we are talking about food system. The Israelis, till today, they do not allow seeds to come inside Gaza. So it is actually this ugly, evil occupation that is trying to expel people out of their land with a long-term policy need to end. And the international community should actually stand against this project before we talk about even building. Another issue, investment actually in institutions rather than investment in individuals. This is very important, because when you just like observe what the Israelis are trying to do right now in Gaza, and they plan to do the same in West Bank, the way, they are targeting institutions. They are targeting universities, hospitals. I mean, those institutions, even infrastructure like municipalities, infrastructure for public services, those actually which are essential for sustaining the resilience of the Palestinian people over their land. Actually, when they are targeting doctors, when they are targeting academics, so they're actually targeting the people that they are essential to sustain living on this land. They are targeting the systems. And what is urgently needed by all humanitarian aid right now is to invest in rebuilding those systems, rather than actually, because it's a very important question, what to do, how to support. At the beginning of the crisis, when the education system was systematically targeted, annihilation of the education system, there was thinking about how to get students out, how to get schoolers out. Yeah. Of course, this is good. This is helpful at individual level. But at national cause level, this is not good. I mean, if we just see all the academics like me, all the doctors like me and Dr. Abu Shomer, or the physician like Dr. Muhammad are leaving, who's going to stay there? Who's going to build the hospitals? And this is what is really essential. We need actually to think how to rebuild the system. And this is one thing. Another thing, Palestinian narrative is very important. Right now, they are talking about international colonial project to control Gaza. This is what we totally reject. Nothing about us without us. We don't need Rivera of Mr. Trump. I don't need actually the new university is going to establish there, this colonial university. I need my national university, my national identity, my national culture, and my national dream. And that should be actually the basis for everything. Participation of the Palestinian people in designing humanitarian early recovery development programmings in Gaza, rebuilding national institutions with national vision to enhance the resilience of the Palestinian people over their land, and standing against the evil settler colonialism agenda to expel the people out of their land. Thank you.
Thank you.
Well, actually, Dr. Ahmed didn't left anything for me, but what I can say that it's really important to have the humanitarian aid intervention, even it's something temporary, but within the context of genocide, it's a kind of more moral responsibility and something critical for survival of the people. But we need to keep in mind that we are afraid to sustain this situation through giving only humanitarian aid. We need to challenge the root causes of this, and trying to prevent any human or man-made humanitarian crisis. We need to address the real cause of the problem with the help of everyone, humanitarian development agencies, everyone. And one more thing that I'm bringing from my previous experience, even prior to the 7th of October, that usually humanitarian aid have a limited time to intervene. So they would try to help as soon as possible, even it can be not aligned with the national strategic plans, for example. For example, within the water sector, usually humanitarian NGOs try to help communities through digging wells, and it's against the national strategic plans because this will bring more stress on the aquifer. So the solution for this is to keep the humanitarian aid aligned with any development national strategies, and to involve local experts, Palestinian experts living there, because they have a lot of experience within this local context that can add a lot to help to sustain any planned intervention and to make it more useful. Thank you.
Thank you.
Thank you, Dr. Reen. Thank you, Dr. Ahmed. Imran. Actually, I don't have a lot to add what my colleagues talk about, but I think, from my opinion, that as a Palestinians, they love their lands. They love their lands deeply and deeply. So we have a cornerstone. What I mean, the cornerstone, so that people there, youth there, doctors, academic people, they are waiting for the support to continue their lives. That means that if this international organization came, they will find people want their support to continue their life. Whatever this support, by the field hospitals, by the medical aids, by the delegations, by the needle for the suture in the operation rooms. So continue helping these people will fix them more and more in their lands. This is the first thing. The second thing, that these people didn't have any problems with the experience. I think to live more than 2 years under this pressure will have a big experience. You will not find it all over the world. So if we continue to support these people, not removing them or extracting them or excise them from their lands, we will help them by the international organization, by political also views and political support, we can help them. Thank you.
Thank you very much. There's a question online that I had to post from Juan Carlos Luis. I can't see your last name there, unfortunately. But Juan Carlos asks, given that the UN is prevented by the UN Security Council mechanism of ending Israeli occupation, and given that the European Union is under the sway of the US via NATO, is grassroots protest the only way left for opposition to occupation and a viable, just solution for Palestinians? So the question of political change.
I mean, it's a valid question, because now just thinking about any rehabilitation, any rebuilding, any resilience model, I mean, to support resilience of Palestinian people over their land, will actually be restricted by this geopolitical context. Like most of the donors right now, actually, they don't want actually to invest in anything that has any long-term investment on the ground, because they say, okay, there is no guarantee that the war will start again. And actually thinking about that, justice is very important. Once I remember I was presenting, always talking about international community rule. And one of the students told me very similar question to this. He said, you just keep talking about international community. Actually, what the international community did for you? There is no justice. The whole system is not there. I said, yes, but it depends on how you define international community. I believe you are the international community. I believe this change in unjust politics is very important. Yesterday, I just joined the flag raising event in Toronto here. And in my talk, I told them, I'm happy to see the flag. I don't need to see actually the melon anymore. Because we do not need actually to use symbols, because we are afraid to use the flag. And this is actually what yes, it is unjust. What happened yesterday actually in the Security Council was unjust, and is not a good solution for us as a Palestinian, and that need to be changed. How to be changed? I think what we are doing right now and what you are going to do as people standing for justice, not only for Palestine, but for humanity, to stand against actually this aggression is something like, I think you are standing for freedom and justice here in Canada, all over the international community. You should have the lead. And therefore, I really appreciate always those events when we discuss actually this, because this bringing actually awareness and for people to participate and to raise their voices for the voiceless people. We are here, three of us, we are Palestinian. And you know what I usually just say, it's ugly to say that there is anything positive out of this genocide. But if we have only one thing positive out of this genocide, the voice of the Palestinian is here now. What you see here, we can see here this in Canada, we can see it in Europe, we can see it in USA. We can reflect actually how this international system is biased and unjust. With your effort, we can change that. Currently, it seems to be very difficult, but young students who are going to control the world in the future, I think they will bring justice. Thank you.
Thank you. Dr. Shamar, Dr. Barayka, do you want to add anything?
Yeah, maybe I just wanted to add that international humanitarian law prohibited anything like this, prohibited those acts. What we need is the enforcement and to have a kind of just accountability system, because if this left without any accountability, it could be repeated anywhere. And we have noticed this thing happening. And I think if you read the history and if you read books about that, you can understand that the colonial mentality and colonial DNA usually agreed the issue that it will not stop within the historical Palestine. It could expand everywhere. It could reach anyone. And we need also to challenge the double standards, because the international humanitarian law respected in some area, it's not respected in others. So we need to, as a human, to keep challenging the double standards and to help with reaching a kind of just solutions for Palestinians and for everyone, because this is part of the humanity. Let me say it like that.
Thank you, Dr. Shamar. Thank you. Thank you all very much. If there's any questions in the room, please feel free to raise your hand, and please stand to just say your name and what department you're from or what group you're affiliated with, and then you can ask a question to the panel and let us know who you want to pose it to. If as you formulate questions, maybe I'll ask another question as well, which is, Professor Abu Shaban, you're talking about institutions. We're talking about the universities that have been destroyed. Can you talk a bit about we're in a university here, many of us are researchers. What is the role of researchers and scholars in universities in Canada to support Palestinian scholars and universities? And what is the role of knowledge production, particularly in this moment? Can you speak a bit to that?
Yeah, I think this is really essential and urgently needed at this current point of time, because as you discover, it's battle of knowledge. It's battle of knowledge and awareness. I mean, if you keep just listening to the mainstream media here, you will end up just having, those terrorist Palestinians creating problems for the poor Israelis, So it is the message that is delivered by the mainstreaming media, which is a biased propaganda. We need to challenge this by production of knowledge. And as researchers, as academics, this is actually our role, is to actually search for the facts and to produce facts and knowledge. Why this is actually urgent at this point of time, especially in Gaza, for two reasons. The first reason, documentation of atrocities and crimes. All the crimes that you see here need to be documented. Maybe the international community and the international justice system fail actually to provide justice for the Palestinians today. But I'm sure, 100% sure, one day those criminals will be accountable for what they did. But at that point of time, we need actually to be ready with the documented knowledge of all those atrocities, not only in food, not only in wash, not only in health, but on all means of life. All the atrocities, whatever your discipline is, we need to conduct research to reflect those narratives and to document the crimes, because this should be a very essential asset to hold those criminals accountable for what they did. This is the first thing. But the other thing, which is even more important, with this colonial project of Trump, and with this, the way he's thinking about Gaza, he's going to rebuild the new Gaza according to his colonial vision. For example, they are talking about a new university in Gaza, and they call it Gaza University of Reconstruction, with the new values, with the new, so the values of democracy and peace, like USA and America are working to promote democracy and peace in Gaza. So what is the danger of that? The danger of that, they are coming with their vision of a colonial system for Palestine, starting from Gaza. While actually, it's very important to say this again, nothing about us without us. Where is the Palestinian narrative and where is the Palestinian vision? I am a Palestinian professor who spent most of my life teaching in Palestine. I should have a say with my colleagues how we would like to see our education system rebuilt. The doctor, he need actually to have the say how he would like to see the health system rebuilt. Average Palestinians should actually have the say, because in one workshop, I still remember, for that university, I was there and they were discussing what is the shape of a new Palestinian leader, what kind of personality the leaders should have. And this is in preparation of this new school. And I told them, the first and the only thing I would like to say about this, he need to be Palestinian. He need to be Palestinian doctor, Palestinian engineer, Palestinian teacher, but first of all, he need to be Palestinian. We don't need Americans to come to build our country according to their vision with the cooperation with the occupiers and the settlers. So for those two reasons, it's very essential to conduct research there. It's very ethical to conduct research there. And maybe I would utilize this opportunity because here at York, we started actually Palestine Research Cluster for all our colleagues, academics, graduate students who would like actually to conduct research in Palestine, doing networking with the Palestinian academic institutions and Palestinian academics on the ground of Gaza to cooperate together. It is, I think, not only ethical, but it's also possible. And it is a win-win situation, I would believe. I mean, I hate to say this, but sometimes I believe even if I'm not Palestinian, even if I don't feel for Palestine, I wish to do research on Palestine because such unique situation we have never observed before. I mean, as a human being, our generation, maybe like 2 generations, we never just see something like massive like this. What is the problem for the Canadian researchers to conduct research in Palestine? You may have the resources, you may have the capacity, but you don't have the outreach. Say that again. No, I didn't hear the last. You may have the capacity, you may have the resources to do research, but you don't have the outreach. You cannot, you are not on the ground. Yeah. The other side of the story, which is you have the Palestinian academics there. They may have the capacity to do, they may have the outreach, but they don't have the resources to do this. And the other side of the story also, I mean, I think boycotting complicit academic institution in Israel is something fair to do. But it seems to be it's very difficult to achieve. At least we can just ask the administration of universities in the West in general to provide some even balanced policies, which is not balanced. I would not consider it as balanced, but even think about it. Just one of my colleagues, I still remember in United Kingdom, we were just presenting there and he asked a question which looks a little bit funny. We were at University College of London and he asked, would you just compare the volume of investment reflecting the cooperation between this university and the university in Israel and this university and the universities in Gaza or Palestine? It's a joke because there is no cooperation. And what is very essential here, we have all of us need to advocate for institutional cooperation model, to acknowledge those academic institutions that are targeted by the Israelis, to erase. And why is education very important? Why is higher education is very important? Because it's reflecting the collective knowledge and the collective culture of the Palestinian people. You see here, I like here one actually very interesting when I came here. I come to learn about great land acknowledgement. What is land acknowledgement? We acknowledge that this land is stolen. We acknowledge the indigenous people were killed, were massacred, were taken out of their land. And now I'm very happy to see indigenous people speaking their language. They are digging on the earth to find about their culture, their language, which is almost lost. And they are trying actually to retrieve that. We still have our culture. It is there. It is in our schools, in our universities, among our people. And this is very important. We need actually to work together to support all the institutions there, working with them at institutional level first. If not possible, we start at even individual level to produce that knowledge, that this knowledge is very important. And this knowledge is very important. What we have here, what we saw, those doctors who were killed, some of them were raped by those criminals. You know about Hind Rajab? We know about Hind Rajab only because there are some people just taking their story, documented, and start to reflect this. But there are 65,000 Hind Rajab. There are around 200,000 people who are injured. It's life-changing injury. We don't know anything about them. And this is a responsibility, ethical responsibility for the humanity to stand for those victims, to hold those criminals accountable. Because for me, now, maybe justice for Palestine is not only Palestinian state. Justice for Palestinian actually to hold those criminals accountable is justice for humanity. Because if Netanyahu and his government are not held accountable for what they did, if they are not punished, then we maybe here in Canada or somewhere else should actually be prepared to see some criminal like those breaking the international law and nobody is holding them accountable. And therefore, I believe it's very important to work together to produce that urgently needed knowledge. And we have actually the mechanism to do this. Thank you.
Thank you, Professor.
I just wanted to add something in addition to partner with the Palestinian academics in Gaza or in Palestine. We need to empower them also. We need to have a publication coming out from the work to reveal the truth and to be heard by everyone. We need to speak the politician language, also the bullet. So to interfere with the and to convince and to provide the evidence, trying to help to change this madness and this kind of colonial mentality. It can be also linked with indigenous people studies also. This would be helpful to both sides. I think maybe
to add, yeah, Dr. Reem, that to stop the double standard, to look to Palestinian people that the people or these people want to live their lives. So to talk more and more about them in universities, in even such these events, and also to help them and help their students to study and continue their studying. As we see in the photos, most of the universities or all of the universities had been destroyed completely. But in spite of that, they want to continue their studying. Before a couple of weeks, I made a contact for my wife to get some papers from Islamic University. And when I talked with the doctor there, he told me, please, Dr. Mohammed, give you 10 minutes. I want to get water from one well and I'll come back to you. academic person, excuse me, please give me time because I will bring water because there is no sink or water supply. I will bring water for my tent, not house, for my tent, and I'll come back to you. And when he came back to me, he gave me all the details what we need. So we should, and I think it's ethical to help these people. Thank you.
Thank you very much. Are there any questions in the room from the audience? Yes. Right.
So much. That was, beyond moving, actually, what you described and how to try and address it. I guess, to me, the question at the top of my mind is there have been proposals for the two-state solution in many countries, including Canada, our government, in support of it. Do you think there's any pathway?
I believe there is only one pathway. If Israel actually is forced to accept any solution. You know why I usually start my presentation with the map? Because even with all what they did against the Palestinian people, taking more and more land, we still have 7 million people over the land of Palestine. And we have 10 million in diaspora.
Thank you.
Yeah, thank you. And you know what is the issue here? The Israelis actually rejecting any type of any kind of solution because Palestinians are ready actually to accept one-state solution, two-state solution, any solution that would just give the Palestinian any means to live normal life. But the Israelis actually are not accepting any kind of solution. Do you know why? Because even if they have one-state solution, what will happen? The majority will be Palestinian. And if it is a democratic state, it will not be a Jewish state afterward. So, two-state solution, this is what Yasser Arafat. Do you know Yasser Arafat, our historical president? He was accused being traitors with the Israelis because he accepted the two-state solution. And he was ready for that. Our current president, actually, he's advocating for, he's begging for that. Even the Palestinian people making jokes about him. Because he was begging the international community to give him a state only over 23% of the historical Palestine. Yeah? And you know what I believe? I don't like to say that. But it is the right wings from both sides are standing against any solution. For Palestinian, we are in a position, as you see, as the history say, actually, you know, my grandfather and the grandparents of the current generation, they had their houses are still there in the historical Palestine. And the Palestinians were ready actually to go for peace, to accept only 23% of their land. The Israelis did not accept that. And what is the solution? I believe the only solution if the international community really stand against this evil settler colonialist project to say enough is enough. Because without this, yeah, no solution will be reached. Not one state solution, not two state solutions. Because the only solution for Netanyahu and his group and his people who elected him is to expel Palestinians out of their land. Ben Gvir was standing in West Bank that day and he was telling the people inside their houses, this is my house, this is not your house. We are going to take you out. With this mentality. But unfortunately, this is not only the mentality, but also they are given political cover and they're given the means actually to do this. And again, we all, not we as Palestinians, because we are part actually, all of us are genocide survivors, but humanity should stand for the Palestinian. We should stand for the Palestinian and actually put pressure on the international community, on the decision makers to change this unjust towards Palestinians. Thank you.
Thank you. There was a question at the back. Go ahead.
Sarah, the Donnelly Institute. So just a question on, I think one of the presentations was around the principles of neutrality. Now, that's the basis of humanitarian assistance everywhere. I'm just curious what exactly you were trying to say there. How do you see that principle changing or not being applicable in the context of Gaza? Because conflict in Gaza now is making a lot of, I'm an international lawyer, it's making a lot of people question the value of things like international humanitarian law, the pressure that the rules-based order is under, and so on. So what is your point around neutrality? And what is the role that the humanitarian community should be playing in a context like Gaza?
So thank you for this question. Actually, I was trying to bring to the attention that sometimes the neutrality and impartiality principles within the humanitarian context can stand by the power of the occupier. When they are trying, for example, to provide the same treatment or the same trying, for example, to find the clearance or to apply for permits. I think the humanitarian sector or NGOs should stand against this clearly. So the point was that treating everyone the same within the context of criminal crimes would be accounted as a support for the occupier in some contexts. So the issue that we need to have a kind of support that take into consideration that this is unlawful, it's unacceptable by every means, by the international law, by the UN conventions, by Geneva Convention. It's something unacceptable. So how come the rules of neutrality and impartiality be applied there? A just solution, I think, to end this awful occupation, the last within the modern history, I hope so, that this will end, to have a kind of decent and just life, that can be as the child in Gaza should have the same opportunities that a person in Canada had, or a child in Canada had. This is my idea, this is my point of view.
I believe this is the same system again. It is international community with the same system. I mean, the same stand of the government everywhere, because those governments are donors. And again, like, if you would like to provide a humanitarian aid, and I lived that dilemma even with United Nations and others, yeah. You need actually to provide the humanitarian aid in Gaza, yeah. So you have to go through, because usually, how do you call an idiot with gun? You just say, yes, sir. So you have to go through this COGAT, yeah. And the COGAT said, no. What is the option now for this donor, United Nations, or any other thing? Is to say, okay, either we just go around it, we change the material, we just find a solution to convince them, or to go public and say, the Israelis are criminals. Now, what actually is preventing them to say that the Israelis are criminal? The same thing that we are actually hesitant to say that this is a genocide. It is the same thing. It is international community is unjust toward the Palestinian. And this is not a new. This is an old story. So again, it is part of the justice for the international community to think about even how this humanitarian is going. How many thousands of trucks of food are waiting outside Gaza? And the only one who's preventing that is Israelis. Now, even in the narrative, and sometimes, you know, I somehow it's sensitive to say that, they keep to utilize this passive language. They don't say, you know, people of Gaza are not starving, they are starved. Yeah, so these are the criminals, but nobody is talking about this. And justice here would mean to stand against the criminals, to tell them that you are criminals. And now, I mean, with the people, when I work with the people on the ground, okay, we need to get the permission of the Israelis. They do not allow to get the permission. So what should we do? We just avoid those material. We use a different material. Yeah. Otherwise, you just go out to advocacy to talk what we are to talk. You never hear about this in the mainstream media here. Yeah. So usually I like this example because, you know, now how many dead bodies in Gaza? I mean, now they have like only 2 of those hostages, dead bodies. Yeah. And do you know how many dead bodies are actually under rubble in Gaza right now? People who don't know actually how to, because they don't have even any tools to get them out. The international community, all the international community, gave all the capacities and needed tools to pick those hostages, dead bodies. But nobody thought about the 10,000 dead bodies buried under the rubble in Gaza. This is the international justice. And this is what when we just say humanitarian, because humanitarian justice here would mean to stand and to say to the criminal, you are criminal, and we should just challenge those criminals, hold them accountable, punish them. Without this, all what we are doing is nothing, because after all, you say, okay, either we do it the way the Israelis would like to have it, or we don't do it at all. Yeah. And then, I mean, as a Palestinian who inside Gaza, facing all this suffering, no, please do it the way the Israelis are doing it. Yeah. Thank you.
Thank you. I'm mindful of the time as well, so thank you everybody for your questions. We can continue this discussions further. We have some refreshments. We have some time for informal discussions with the group. I want to thank so much our panelists, Professor Abu Shaban, Dr. Abu Shamar, and Dr. Al Barayka. Thank you so much for joining us.
Thank you.
For sharing
Thank you very much.
with us.
Thank you. Thank you. Thank you. Thank you.
Thank you. Yeah, and I want to thank as well the Dawa Institute, Mary, Teresa, Natalie, Charlotte, Gaurav, Tove, Naima for helping us organize this session. Thanks also to the IT person for setting up the equipment here. Thank you all very much. It's the first of hopefully 2 panels. We'll have a new one in the new year that will look more at the legal and international policy aspects, building on today's session. So thank you all very much for joining us, and we look forward to chatting with you tomorrow for coffee.